Antidepressants. You've probably heard of Prozac, Zoloft, or Lexapro. They're SSRIs, selective serotonin reuptake inhibitors. They don't create happiness, they recycle it. SSRIs slow serotonin cleanup, so it lingers longer between brain cells. It takes weeks for receptors to catch up. SNRIs, like Cymbalta and Effexor, do the same thing, but add norepinephrine for alertness and focus. That's why some people feel energized while others feel jittery. The real effects? Flat emotions, reduced libido, emotional numbness. You stop feeling depressed, but you also stop feeling much. Here's the part doctors don't emphasize. Your brain adapts. Miss a dose and you don't just feel sad, you feel weird. Electric shocks in your head called brain zaps. Stop suddenly after months of use and some experience withdrawal that feels nothing like depression. More like static running through your entire nervous system. The upside? For many, it steadies the floor, so life stops falling apart. The downside? It can also sand down the edges you used to recognize as you. Benzodiazepines. When panic hits, your brain's alarm system is in overdrive. Benzos shut that down fast. They flood your brain with GABA, slowing neuron firing and calming everything down. Xanax and Valium flood the system with it. Heart rate drops, muscles unclench. The panic stops, but your brain adapts fast. It stops making its own GABA because it's getting chemical reinforcements. That's when dependency slips in. Benzos are one of the few medications where stopping cold isn't just uncomfortable, it can trigger seizures. Your brain literally rewired itself around the drug, and when people try to quit, the withdrawal isn't subtle. Anxiety rebounds even worse, often with tremors or seizure risk. That's why doctors taper them like defusing a bomb, slowly, carefully, and with a lot of respect. Stimulants. Stimulants boost dopamine and norepinephrine in your prefrontal cortex, the part of your brain responsible for planning, filtering, and actually finishing things. Suddenly, the background noise goes quiet. Thoughts line up. The task you've been avoiding stops feeling like a brick wall. For people with real ADHD, it's the first time their brain behaves instead of improvises. But dopamine isn't just focus, it's motivation, pleasure, and reward. Push it too high and the system tilts. After the rush comes the slide, fatigue, irritability, emotional flatness. Long-term use doesn't just raise dopamine, it reshapes how your brain responds to it. Normal rewards lose their pull. Food tastes duller. Hobbies feel like cardboard. That's anhedonia, when your reward system shows up but doesn't clap. And it doesn't take huge doses. Even normal prescriptions can shift your baseline. Your brain adapts to the elevated dopamine, so off the medication, everything feels dim. That's why people stay on stimulants longer than planned. Life works on them, but life feels muted off them. Stopping isn't graceful. The crash hits hard. Low mood, zero drive, and a reward system that needs weeks to wake back up. Antipsychotics. These drugs shut down psychosis, delusions, hallucinations, racing thoughts. They work by blocking dopamine receptors. When dopamine drops, so do emotion, motivation, and joy. You stop feeling haunted, but you also stop feeling much. Abilify also hits serotonin, which adds weight gain, drowsiness, and a slowed down metabolism. And because dopamine controls movement, blocking too much can trigger tardive dyskinesia, involuntary twitches, stiffness, or rigidity. It's rare, but once it shows up, it tends to stay. Long-term use can even shrink parts of the prefrontal cortex, the region responsible for planning and decision-making. For people with severe psychosis, the trade-off is worth it. The mind quiets, reality stabilizes. But it comes with permanent changes. Many describe it as watching life from behind glass, present but detached. Mood stabilizers. When emotions swing dramatically, mood stabilizers create stability. Lithium's the classic, an element that changes how neurons talk. It lowers electrical firing, softening manic surges without killing emotion. You can still feel, just not all at extreme levels. Lamictal and Depakote work differently. They regulate glutamate, the brain's accelerator, and calm overactive circuits. But lithium's the tricky one. The margin between effective and toxic is razor thin. Too much causes nausea, tremors, confusion. Too little, and the mood swings return. That's why lithium users need regular blood tests to monitor levels. Long-term, lithium can stress your kidneys and thyroid. Some people don't get checked enough, and they find problems years later. Many long-term users describe the same thing. Life feels quieter. Not great, not terrible, just steady. For people with bipolar disorder, that steadiness feels like peace. The trade-off? It works well, but it needs monitoring and a doctor who actually pays attention. Anticonvulsants. Originally designed for seizures, these drugs got repurposed for mood and anxiety. They work by slowing your brain's hyperactive circuits. Topamax reduces glutamate, the brain's go signal, while boosting GABA, the calming chemical. Gabapentin dulls overexcited nerves, slowing racing thoughts. The result? Less anxiety, steadier mood, fewer emotional spikes, but there's a cost. Alongside calm comes cognitive fog. People report trouble finding words and slower recall. Topamax got the nickname Dopamax because of how it affects memory and mental sharpness. Some people never fully recover that speed even after stopping. You're trading mental quickness for emotional stability. Most adjust, but some stay slower. For people whose anxiety or mood instability is severe, that trade-off makes sense. For others, the cognitive cost is a deal breaker. That's why these drugs work better for some people than others. It depends on what you can live with. Antidepressant alternatives. Not all antidepressants work through serotonin. Bupropion, Wellbutrin, targets dopamine and norepinephrine instead. It wakes up the system, sharpens focus, and can help smokers quit. Because it skips serotonin, you avoid numbness and libido loss. But the trade-off, some people experience increased anxiety, racing thoughts, and insomnia. It's motivation with a side effect package. Ketamine is different. It's an anesthetic that, at small doses, resets how your brain processes glutamate. Relief can show up in hours instead of weeks. The catch, it's temporary, lasting only while treatments continue. Stop the sessions and depression usually returns. It's not healing in the traditional sense. It's a reset you have to keep hitting. Transcranial magnetic stimulation, TMS, skips pills entirely. It uses magnetic pulses to stimulate underactive brain regions. Fewer side effects than medication, but it takes weeks and is expensive. It's slower than ketamine but more permanent than most pharmaceutical options. All three prove it. Depression isn't just a serotonin issue. Sometimes it's underactive brain regions, sometimes it's glutamate dysfunction. The brain's more complicated than single chemical fixes. Tricyclic antidepressants. These are the old guard, developed in the 1950s and still prescribed today, especially for chronic pain and insomnia. Tricyclics hit several brain chemicals at once. That broad approach works, but the side effects are relentless. Anticholinergic effects are the main issue. Tricyclics block acetylcholine, which controls saliva, digestion, urination, and vision. Users report severe dry mouth, constipation, blurred vision, and urinary problems. These aren't minor. They're lifestyle changes that don't go away. The dangerous part, tricyclics are cardiotoxic. Overdose can cause fatal heart arrhythmias, which is why they're prescribed less now than SSRIs. Weight gain is significant. 10 to 15 pounds is common. Sedation varies wildly. And tapering takes weeks or you get rebound anxiety and flu-like symptoms. They work, but the trade-offs stay buried in fine print. MAOIs. MAOIs are the antidepressants nobody wants to take. They work by blocking monoamine oxidase, an enzyme that breaks down serotonin and dopamine. So these neurotransmitters stay active longer. But the same enzyme breaks down tyramine, a compound in aged and fermented foods. When you take an MAOI and eat aged cheese, cured meats, or fermented products, tyramine builds up and your blood pressure can spike dangerously, sometimes to stroke-level heights. On Nardole or Parnate, no aged cheese, cured meats, or fermented foods, your menu shrinks fast. The list is long. MAOI users check every label and avoid restaurants altogether. Some feel the depression relief is worth it, others can't stick with the restrictions. MAOIs also interact with almost every other drug. Cold medicines, stimulants, pain relievers, all can trigger serotonin syndrome with rapid heart rate, high fever, and muscle rigidity. For some with severe treatment-resistant depression, MAOIs work. But they demand constant awareness and lifestyle changes. Mirtazapine. Mirtazapine doesn't fit neatly into any category. It blocks some mood receptors so others fire harder. It's effective for depression, but people take it for a specific reason. It knocks you out and makes you hungry. At lower doses, 15 to 30 milligrams, mirtazapine causes intense sedation. People fall asleep within an hour. Higher doses cause less sedation, which is counterintuitive. The hunger is also intense. Users describe constant cravings and significant weight gain. 10 to 20 pounds in the first few months is common. Some gain more. Its sedation makes it a go-to for insomnia, even in people without depression. It works, but you're dealing with daytime grogginess and metabolic shift. Sexual dysfunction is less common than with SSRIs, which is a plus. But the weight gain and sedation are serious enough that many people quit within weeks. It's a miracle for some, intolerable for others. Antipanic and sleep drugs. When anxiety loops and sleep won't come, these are the options. Buspar calms serotonin pathways without sedation or dependence. It's steady but slow. Users often need to take it for weeks before feeling real benefit. It's anti-anxiety training wheels, stable but subtle. Ambien works differently. It's a sedative that targets GABA receptors involved in sleep. It hits fast, sometimes too fast. Some eat, text, or even drive in their sleep. No memory after. Memory gets foggy. The line between sleep and waking action blurs. Trazodone started as an antidepressant but now mostly treats sleep. It blocks serotonin reuptake lightly while dragging your body into sleep mode. You don't sleep from peace, you sleep because chemistry said so. The problem with all three, they address the symptom, not the cause. Your brain obeys the drug, even if you haven't actually resolved what's making you anxious or keeping you awake. If your brain made it this far, reward it. Hit subscribe. It's the easiest decision your brain will make today, and it gets you an A+ with 0 side effects.